My name is Randy Bigley. Joining me now from the National Alliance on Mental Illness, you know as NAMI probably. Jennifer Jennett's with me. And reminder, this podcast is brought to you by First Federal Community Bank. Jennifer, thank you for coming over on the podcast today.
Well, thank you for having me. I appreciate being here.
Thank you. This is the first time I've had NAMI on here.
Really?
Yeah, I mean, NAMI's probably the most famous one, most popular, mental illness organization that you hear about, right? I hear.
It is. It's the largest grassroots organization. But I feel like we are kind of like a little unknown secret that is underutilized. So thank you for having me here.
Well, you're welcome. Anytime. You're always welcome here. NAMI, what is NAMI? If people, they've heard the term, maybe they don't know what all you guys do.
Okay. So I like to tell the history of NAMI and how it was formed because it describes really what we are. So there was a woman who had two friends and that weren't friends, and they both had a child, an adult child, that was experiencing mental illness. And she said, you two should get together and talk because you're experiencing these things and you could, be supportive of each other. And from that, these women started NAMI. And that is really what NAMI is all about. We provide education. We provide education to just the public to help reduce stigma around mental illness. We provide education to family members, community members about mental illness. And the other thing we do is we have groups and we have educational classes. So we, Marion Crawford County, we offer a connections group, which is a support group for those who are experiencing mental illness. And then we have a family support group that are for family members whose family member has mental illness. And then we have several education classes. The one that I really like to point out is the family support group. We have one coming up in October here in Bucyrus. And that is an education class for family members to help the families understand how to navigate, someone that's experiencing, their loved ones experiencing a mental illness. So, and then we do outreach. So we're out in the community. We're advocating for funding to support issues with mental illness. We're just bringing awareness. So we do lots of things, lots of different things.
Exactly. I don't think people don't realize how much it affects the whole family. It's not just that person that has the mental illness, it's the whole family.
It is. And I say not only, siblings, parents, but grandparents, children, aunts and uncles. It really affects the whole family and the family dynamic.
It does. And the stigma of mental illness is... people don't want to talk about it. It's a disability. It's no different than having missing an arm or missing any kind of physical disability. It's a mental disability. It's something that it's a chemical in your brain. It's something that this person's not their fault. It's what they have.
It is not their fault, and it is so much more common than most people realize, and it's because the conversation is not always there. But 1 in 5 Americans suffer from some sort of mental illness or are living with it. That's pretty common.
Yeah, that's pretty common.
And I think we're getting to a place now in society where we can talk about it a little bit more. I think COVID, opened a door for more conversation and discussion. But yeah, it's very common. It's no one's fault. It's no one's to blame. It's just what it is.
It's not your fault that you raised your kids not the right way or something, when they have issues, but it's just something that it is. It is.
It is. And sometimes it can just truly be genetics or how your brain developed. There's lots of reasons why mental illness occurs, but it is common, and I'm glad we're talking about it more.
And it's nice that people are able to have, ways of getting help now. I mean, that's something, if you have a mental illness, you feel like you're on an island somewhere. You feel like you're lost, and you feel like there's, you're the one crazy and nobody else is. Well, there's other people that have this issue too out there too that you don't realize. It's not just you. And this is, and of course, we like NAMI, you guys give people the help that they need, and so they're not suffering alone, and they're not thinking that they're just crazy and it's just the way it is. And I say that because I think that people that happens, and people think they're the only one in the world that has this problem, and it's not true.
Yeah, and I think it's difficult to recognize symptoms that this is what's happening to you. You know, if you're not talking with someone about what you're experiencing, it may not go recognized as a mental illness. And yeah, I mean, in all fairness, we do have a shortage of mental health providers. In Crawford County, there is only one provider per 750 people of population. So we definitely do not have the adequate connection and care. But I think, you know, organizations just like NAMI, although we're not a therapist or we can't provide therapy, it's that connection that you talked about of connecting with others, understanding your illness more, being more educated about your illness and medications and other treatments that help, you know, and so that's where I see NAMI too as being so important, is bringing that connection among folks. Like you said, you're not on an island by yourself.
I remember my grandmother, before she passed, I had, you know, I do suffer from panic attacks. I always have my whole life. And I found out my grandmother had those. My grandmother said that she couldn't tell anybody back then because they would lock her up somewhere.
Yeah.
I mean, that's how it was back then.
Yeah.
I mean, you know, I think people still worry about, they're just going to lock me up. And that's not the way it is anymore.
It's not the way it is anymore. And, you know, there's just so many different treatment options and ways to deal with things. We've come far that, we've gotten so far away from that of I'm just going to be locked up.
Yeah. That's because you hear those. They're gonna put me in a straitjacket, put me in some room,
Right.
a padded room. That's not what happens. And you know, and there's medication available out there, and I've seen medication change people's lives.
Yeah.
I mean, completely change them. Yeah.
If it's truly something that is not going right in your brain, then it's probably not going to be better unless you have the right medication that's going to offset that.
Sure.
So medication can be a really important part of treatment.
Excellent. So talk to your family doctor. If you got some issues, say, hey, this is what's going on. And they can get you in the right direction there and get you some help, right?
Exactly, 100%.
You don't have to live with it alone.
Yeah, the other thing that NAMI does that if you don't mind me mentioning,
No, go ahead.
Is that we're very involved too with crisis intervention training, so the CIT training. And what that training does is help officers recognize the symptoms of mental illness when they respond to calls. I just want to point that out because, again, I think it's so important that sometimes your behavior or your actions, you know, can be related to a mental illness. And what's so great about that is we're trying to deter people from going into the Department of Corrections or in the judicial system if it's truly something that's happening with their mental illness.
Sure.
So I just wanted to mention that. Stepping Up initiative is also something we're involved in Marion Crawford County. Again, it's providers, it's the court systems, the judicial system, all of us coming together to try to work towards deterring the deterrence of people with mental illness going into the Department of Corrections.
Wow. Yeah, that's and they're, you know, they're actually training officers, aren't they, to recognize this, right? Yeah.
Yes, every officer in Marion and Crawford County is either trained or will be trained shortly. They receive the training, and it's great that our leadership makes that a priority in these counties. And so we're doing good things.
Because that's something that, you know, that's totally new, isn't it?
It is newer, yes.
Yeah.
It is newer over the last several years. It has been. We're looking at things different, which is where we need to be.
Exactly. Changing that mindset, right? Exactly. If someone needs help and needs your services, how can they get a hold of NAMI?
Well, you can get a hold of Marion and Crawford NAMI by calling our phone number, 740-375-0796, and that will go to our Marion office. We have a website that you can connect with to see what's going on and what we're doing. You can also, it has the ability to send us an email. I will say as well, and I don't have it right here handy, but NAMI Ohio has a helpline.
Okay.
And that's easy. Just Google NAMI Ohio helpline. And they're available daily, and a trained professional would be able to answer questions. Now, I will say that's not a emergency number. Of course, you want to call 988 if you would have a mental illness emergency. But for just to talk to someone, maybe talk about what's going on with you. Look for resources. I would recommend the NAMI Ohio helpline. National NAMI also has a hotline.
Okay.
So we have lots of resources to get people connected.
Now, are you guys available to speak different places or?
Oh,
or
yes.
Yeah, okay.
Yep.
And the same thing, go on the website or just get a hold of you guys that way too?
Yeah, just get a hold of us. And that's been a goal of mine. I started with NAMI Marion Crawford last fall,
Okay.
and getting into the community, in both communities, and bring more awareness of NAMI has been on the forefront. That's what I've been really focusing on.
All right. Jennifer, thank you for coming in. I really appreciate
you
you
so
coming
much.
in and talking about this. This is important in my life and your life, and there's a lot of people out there listening that either maybe themselves suffer with something or have a loved one, and like I said, it affects the whole family.
It does affect the whole family. Thank you so much for having me here today.
Jennifer, you're always welcome here. Thank you for coming. I really appreciate it.
Thank you.
And we will definitely have you back again. How's that sound?
Good. Great. Thank you.
You're welcome. This podcast is brought to you by First Federal Community Bank. Thank you so much, Jennifer.